Now 38 years old female. Note the findings. So finding number 1, the liver is cirrhotic. As you can see that the outer surface of the liver is irregular. See the texture is coarse and highly raised echogenicity, and there is fluid surrounding its outer surface. This is the fluid surrounding the outer surface of the liver. This is the gallbladder being seen, full of sludge and with internal echo. This is the sludge. These are the calculi within it, giving shadow, as you can see, and the wall is giving this appearance because of diffuse parenchymal liver disease as well as ascites. Now we come to the portal vein. See the portal vein. This tubular structure is the portal vein, and there is an echogenic area, irregularly outlined echogenic area within it, which is a clot, or you can say that the portal vein is thrombosed, and it measures approximately 12.1 mm in this location. Is there any flow? Now you will note one thing, that there is no flow within the lumen of the portal vein. Rather, multiple collaterals have developed around the portal vein, which is suggestive of cavernous transformation of the portal vein, or otherwise you can say it is suggestive of recanalization of the portal vein. Hilona ji, Hilona. Here you see peripheral vessels are definitely seen, but as such there is no flow within the portal vein. Now this is the portal vein. This is the lumen of the portal vein. These are all collaterals along its margin. Let us focus again and see again. In fact, there is no flow. The lumen is seen, and even if the flow is seen, it's a retrograde or hepatopetal rather than being hepatopular. So there is portal vein thrombosis with peripheral collaterals or recanalizations. These vessels are suggestive of recanalization of the portal vein or cavernous transformation of the portal vein. You can see here clearly. This is the clot. This is the clot. Full of clot rather. Now when I move towards this side, up towards the anterior segment of the right lobe, I see a globular echogenic area, evenly echogenic, measuring approximately measuring approximately 3.06 by 3.03 mm, and this is a solid focal lane. This is the so-called solid focal lane. No posterior wall enhancement is seen, and anterior to it is another focal lane. Now this focal lane, this one, peripheral flow is seen around this focal lane. However, there are no internal vessels within it. This is echogenic, solid, and has a halo around. If you see, this is a black halo around. So this is the second focal lane being seen in the cirrhotic liver, and and is very much consistent with as regards appearance with hepatocellular carcinoma, HCC or hepatoma. A little bit more of this focal lesion in light blue. No significant internal blood flow is seen in this focal lesion. Okay, now excuse me, to show you something within this patient. See the right kidney, and the right kidney is massively hydronephrosis. This is the right kidney measuring 12.3 into 5.2 is enlarged, and if you see, this is the pelvis and this is the pelvic-ureteric junction. Here a calculus is seen measuring approximately 3.18 mm. So the hydronephrosis, because of this hydronephrosis, is the calculus within this PUJ. Here it is. This is the calculus. This is the calculus. Now this is the right kidney of this patient with cirrhosis as well as focal lesion. Focal lesion you can see here, portal vein thrombosis here, clearly seen, and this is the kidney on the right side of the patient. And then I will go towards the left side. Same situation over here. This kidney is also massively hydronephrosis, and this is the proximal ureter. I can trace the proximal ureter only up to this region. From where onward, the gases are interrupting. And this is the photo from up to this level I can trace, and this is the status of the left kidney. Left kidney is also massively hydronephrosis with thinned out parenchyma, and this is the only parenchyma in this kidney that can be seen and is thinned out, or relatively thinned out, by 10 mm at the upper pole. So bilateral massive hydronephrosis. This is the lower pole, and this is the total kidney. This is the spleen. And spleen measures approximately 17.7 up to 12 is considered normal. So the spleen is enlarged. This is the this is the pelvis. This is the proximal ureter of the left kidney. 12 mm and up to 7 is normal. So the left kidney is also hydronephrosis. Then I come downwards. This the pigment from Gujranwala. This is the urinary bladder. There is no pathology that is seen in the urinary bladder. See the ascites. This is ascites. This is urinary bladder, ascitic fluid, and here you will see the uterus. This is the uterus. No pelvic pathology. So this is our case of today, showing you multiple pathologies. This is the caudate lobe and IVC, caudate lobe, and this is liver, caudate lobe, ligamentum venosus. This is the liver left lobe in transverse section. Here you will see clot in the ascending part of the left portal vein. This is the ascending part of the left. This is the clot here. This one. Clear is seen. Here we see. Sirf 2 minutes. This is the left portal vein. Again you will see collaterals around it, but no flow within the dilated vessel. This is the dilated left portal vein, right portal vein, and you can see multiple vessels within it. And this is our see clot within dilated, not dilated portal and multiple focal mass lesions. And this one of these is for sure being is of aggressive nature. This one. Patient is restless, listening device. Here we are. Now in this image you will see that this is the this is the tube-like structure filled with clot. Otherwise it should be as clear or black as this region is. So portal vein is in this region, however it measures approximately 13.9 is dilated, and this is the liver coarse texture, and this is the focal lesion, this one, focal mass lesion, solid, inhomogeneous in the anterior segment of the right portal vein. So this is our case of the day. Thank you very much.